The recently passed federal health care reform would have some impact, perhaps, on the proposed Minnesota health care plan, your proposed plan. What do you see as the interaction between the newly passed health care reform and your hopes and ambitions for health care in Minnesota?
I'd say it's a big step forward in some very important ways. Lately, I've been trying to give people a better sense of the scope of the healthcare problem, and not in terms of what it means to the person I met in Mora who had spent all of Friday trying to call dental clinics trying to find someone who would pull two of her teeth that were hurting and gave up because she couldn't find anyone and she was hoping to go to the emergency room for a shot of Novocaine the next day. I mean, not to talk about that, but talk just to the point of people who lose their lives by it. I use the analogy that somebody suggested to me of the Vietnam Wall in Washington has 58,000 names on it. And I was turned draft age right after the war ended, but I remember thinking what a terrible waste of life that war was. 58,000 people, and each one of those names, 22, 24-year-old, and you think what that meant, the loss of that person to their parents, to their siblings, to their spouse if they had one. And that the scope of what our problem of health care is, 45,000 people a year die from a lack of health care. We would fill a new wall, not in a 20-year war, but every year and a quarter with the number of people who die with the lack of health care. The reform in Washington, by covering more people with basic insurance, I think it'll cut that problem by more than half. So maybe we'll have 25,000 fewer people a year dying, and that's amazing. That's amazing change. But on the other hand, it gets back to the example I gave about slavery. Well, you made some progress, but you still got to fix the problem. And if there are 20,000 people still dying from a lack of health care, we ought to be angry about it. So yes, I see the federal thing as a big step forward, but it doesn't address the concerns about the cost. It doesn't address the other issues, and the idea that we would treat health care the way the Universal Declaration of Human Rights that our nation did sign 60 years ago, where everybody has a right to health care, like they have a right to public education, right? They have a right to public safety. The idea that we're going to treat it I like to compare it to police and fire. You go home tonight and you find your home is being burglarized. You call 911. The police dispatcher doesn't ask if you got police insurance. And they don't ask if your policy covers home burglary, and they don't ask if you got pre-existing conditions. We could do that with health care. That's what other countries have done. And we ought to do that. And so, thank you. So I guess what I'd say is the federal change is historic. It is major. It's the biggest change in federal health care policy since the 1960s, and it will cover 31 million more people. And the goal should be, let's make sure we cover everyone and we cover everything, because health insurance doesn't get you, I mean, I've been using this example in Massachusetts several years ago. They already passed the mandatory you must buy insurance, and that gets, most people will be covered. But if your problem is dental care, if you've got rotten teeth and you're forced to buy a health care policy, the basic policies rarely cover dental. Well, then you're spending some of the money you don't really have enough of, and you are less likely to be able to get the dental care you need. And I happen to think that you know, if other countries can provide it, we can do it too. So I'd say it is a big step forward. We got a big step to go, and I think it's a doable step, and that's what I want to accomplish in the next couple of years. So.